So you're thinking about becoming a helping hand to a doctor and joining the healthcare field. Let's break it down if this is the right career for you. In this episode, we're going to simplify what it means to be a nurse. What is a nurse? A nurse is an advanced practice registered nurse, somewhat like a variation physician assistant. Nurses tend to patient needs, order tests, diagnose conditions, and create treatment plans. Their training covers disease prevention, patient education, and managing various conditions. However, their expertise might not match that of MDs or DOs right after graduation, although experience helps them handle more complex cases. Specialization in nurse doesn't involve residency or fellowship like in medicine. Nurse education is more focused from the start, with programs in specific areas: primary care, acute care, family, women's health, and more. The nurse program you pick influences your future practice. In contrast, the medical school you attend has less impact on your medical specialty. In surgical settings, nurses play a role as the first assistant, not performing the surgery itself, which is the surgeon's responsibility. Now, to ease a bit of your pressure, here's a myth. Experience alone isn't enough. Being a nurse requires specific training beyond just being a registered nurse. How to become a nurse? Let's break down how to become a nurse. It's a bit different from the path to becoming a doctor. In nursing, there are various advanced practice roles, and we're focusing on nurses. There are also nurse anesthetists, nurse midwives, and clinical nurse specialists, each specializing in different areas. Now, becoming a nurse can follow two main paths: traditional and direct entry. The traditional route starts with earning a nursing degree like BSN or MSN, becoming an RN, and then pursuing a master's or doctorate in nursing. This typically takes 2 to 5 years. The direct entry path is for those with a non-nursing bachelor's degree. It's a 3 to 5 year program where you become an RN and then pursue a master's or doctorate to become a nurse. Whether you go for a master's or doctorate doesn't hugely impact your practice or pay, but more programs are leaning towards the doctorate, especially if you're interested in research or teaching. Once you finish your chosen path, you take a certification exam specific to your specialization. After passing, you can apply for state licensing and start your nurse career. In terms of cost, nurse programs are generally more affordable than PA or medical school. Now, what about the perks of being a nurse? On average, you can earn around $110,000 per year, though it varies based on your specialization. Women's health might start around $98,000, while acute care or mental health nurses could be at the top, earning around $114,000. So, becoming a nurse offers a decent salary and various specialization options to suit your interests. The pros and cons. Being a nurse has its perks, but it's not everyone's cup of tea. On the positive side, you get a good work-life balance without often dealing with things like overnight calls. You'll also have some autonomy in decision-making, and your training is shorter than becoming a physician. However, it's not all sunshine. If you're eyeing surgery or want more flexibility, the physician assistant or PA route might offer more opportunities. While nurse training is quicker, the pay is usually half or a third of what physicians make. If prestige and respect are crucial to you, the MD or DO route might be more satisfying. Nurses usually have fewer clinical hours compared to PAs and physicians, which sparks controversy over their scope of practice. Should you become a nurse? Deciding to become a nurse depends on your preferences and career goals. If you enjoy teamwork, patient education, and making care decisions, the nurse path might be a great fit. It's a shorter and less costly option than medical school, making it appealing for those who want a quicker, shorter route. If you're already on the nursing track and aiming for advancement, becoming a nurse could be a natural progression. However, if you lean more towards the medical model, you might consider the physician assistant